Jay Pendleton, MedTech Voice here for 5 Good Minutes with Dr. Dan Choi, Long Island, New York, private practice, orthopedic spine surgeon. Thanks so much for sitting down with us. Welcome to the show.
Absolutely. Thanks, Jay. It's an honor. I've been watching you and following you on social media, and you're doing an incredible job storytelling, telling the stories of lots of different physicians and colleagues of mine. And it's just been great watching your journey and watching other people's stories as you tell them. So thank you for having me.
2021 was when I met you, Future Spine Leaders course. And you were already all over social media, and to see your growth in this space for the last 3 years has been remarkable, because you give us a view into what it's like to be an orthopedic spine surgeon in New York City.
Yeah, and I think that's the beauty of social media, right?
Yeah.
You're telling the story, the behind the scenes look, as much as you can do it professionally and make sure that patients are comfortable. We're not going to take a phone and put it in a spine wound and things like that. But at the end of the day, yes, I think that social media, what appeals to a lot of people, the general mass, is that you follow your celebrities, right? And you get that kind of behind the scenes look at Kim Kardashian and what are they doing after a Taylor Swift show, like backstage.
Right.
And so they also want to know about their physicians too.
That's right.
In some ways, they want to know their, kind of personal life, if you're willing to put it out there. But even if you don't put that out there, you could put educational content out there, more information about why spine surgery is indicated, why you use a certain implant. All those stories can be told effectively through social media.
But what have you learned, or maybe what have been some of the most surprising or most difficult things from going out on your own? It's a bold move.
So I'd rather regret the things that I have done than the things that I haven't, right?
Amen.
So I think for me, I've always thought about what would happen if I could kind of tell my own story, build my own brand, also the operation side of practice. You look around and you're like, no, this is not the way. If I had full control over this is not the way I would run it. This could be so much more efficient. I know as a physician exactly what the patient needs. For me to deliver high quality care, for me to make sure that they have a great experience in my practice. These are all things that I know about the patient experience that I want to change right away usually, and doctors are burning inside to do it, but typically in a corporate medicine setting, it's very difficult to do that, right? You have multiple committees and the layers that you have to go through to enact changes in the operations side is very hard to do, and private practice gives that autonomy back to physicians. You could basically control everything. Now, you also live with the headaches of that, right? Now you're not just a doctor, you are also in some ways a small business owner, so you have to, if the fax line goes down, the Wi-Fi goes down, it's on you. You got to figure it out. So, it comes with the good and the bad. For me, the autonomy is priceless. You can't put a price on that. As consolidation grows in healthcare in America, you see physician burnout growing as well.
Absolutely.
Because physicians are now having their autonomy taken away from them, and medicine's a profession. We've always been a profession where the doctors could make their decisions, the best decisions for their patients, and now we live in an environment where it's not necessarily always the case. You have everything run by spreadsheets. You have MBAs who don't really understand what happens between the patient-physician relationship,
That's right.
making decisions, distributing resources. And I think that is truly driving burnout and really exacerbating the physician shortage in this country, as you see all these physicians saying, how do I get out? How do I stop practicing? And I think private practice, I can tell you, private practice is hard, but I've never met, I think, an independent practice in this environment where it's so hard to be private practice, and these doctors stay in private practice and they stay autonomous. I've never met one that's burned out, to be honest. They still love what they do. They go to work with a big smile on their face. I love every day in my office. I love my employees. And we've been able to successfully stay financially viable through advocacy work. You see me talking about that. So this is huge for us.
Wonderful. Thank you so much for sitting down. Can't wait to see your talk. And best of luck to you for the rest of the year and beyond.
Thank you,
It's
Jay.
a pleasure.
Thanks for having me.
You bet.